What if your fatigue or headaches were early warning signs of cancer? Cancer is a global concern, but do you know the early signs that might be developing in your own body? Are you aware of the warning signals your body could be sending? Many subtle symptoms could suggest cancer is growing, yet they are often easy to overlook. Recognizing these early signs is crucial and could even save your life. Did you know that approximately 19.3 million new cancer cases were diagnosed worldwide in 2020 alone? In the United States, the American Cancer Society estimates that over 1.9 million new cancer cases will be diagnosed in 2024. Our bodies are constantly fighting cancer cells every day. The food we eat and the lifestyle we choose to live can significantly help in this battle. If you want to live a long and cancer-free life, you have to act now. In this video, we'll guide you through the key indicators to watch for and explain why they can vary from person to person. Join us as we clear up the confusion and provide you with verified information on the early markers of cancer. It could be the difference between life and death. Sign 1. Persistent fatigue. You wake up every day feeling exhausted, no matter how much you sleep. That's how many people with cancer-related fatigue feel. This isn't the usual tiredness from a busy day. It's a deep, unrelenting exhaustion. Persistent fatigue can be one of the earliest signs that cancer is growing in your body. Cancers like leukemia or lymphoma can cause this type of fatigue by disrupting your body's ability to produce healthy blood cells. As a result, you feel worn out no matter how much rest you get. Interestingly, studies have shown that cancer-related fatigue can sometimes be alleviated by regular physical activity and proper nutrition. According to the American Cancer Society, fatigue is often the first symptom reported in about 80% of people with cancer. Have you been feeling unusually tired lately? And could it be more than just stress or overwork? Don't ignore these signs. Your body might be trying to tell you something critical. Sign 2. Persistent headache. Imagine having a headache that just won't go away, no matter what you do. If it's been more than 2 weeks, it's time to take it seriously. Persistent headaches could be a warning sign of something more serious, like a brain tumor or other brain cancers. Alongside the headache, you might notice blurred or double vision, changes in hearing, or even facial drooping. According to the National Cancer Institute, around 50% of people with brain tumors experience headaches. These headaches are often different from your typical headache. They can be more severe in the morning and may come with nausea or vomiting. Did you know that brain tumors can sometimes cause personality changes or seizures as well? What if that headache you've been dismissing is actually a sign of something much more sinister? Get these symptoms checked promptly to rule out serious conditions and ensure timely treatment. Sign 3. New or unexplained pain. Do you feel a nagging pain that just won't go away? It doesn't have an obvious cause and doesn't respond to regular treatments. This could be your body's way of signaling that something is wrong. Persistent pain that doesn't have an obvious cause should be evaluated by a doctor. For instance, abdominal pain could indicate prostate, bladder, testicular, or penile cancer in men, while unusual pain or sensitivity in the breasts might be a symptom of breast cancer in women. Pain can also be a symptom of internal cancers like liver or pancreatic cancer. The Mayo Clinic reports that nearly 20% of cancer patients experience pain as an initial symptom. Interestingly, research has shown that chronic pain might be linked to an inflammatory response in the body, which can sometimes be a sign of cancer. Are you experiencing persistent pain and dismissing it as something minor, unaware it could be a sign of cancer? It's crucial to listen to your body and seek medical advice if you have unexplained pain that doesn't go away, ensuring any serious conditions are caught and treated early. Sign 4. Changes in urinary or bowel habits. Have you noticed changes in your bathroom habits? Persistent constipation, diarrhea, or changes in urination can be early warning signs that something isn't right in your body. These symptoms might seem minor, but they can indicate serious conditions, including cancer. Changes in bowel habits could be a symptom of inflammatory bowel disease, or signal colon, or stomach cancer. Similarly, changes in urination, such as pain, increased frequency, or a weak stream, could point to urinary tract issues, an enlarged prostate, or more serious conditions like prostate or bladder cancer. The American Cancer Society notes that colorectal cancer is the third most common cancer worldwide, and changes in bowel habits are often one of the first noticeable symptoms. Interestingly, some studies suggest that regular screenings and a diet high in fiber can significantly reduce the risk of colorectal cancer. Are you noticing changes in your bathroom habits and ignoring them, thinking they're just a temporary issue? It's always better to be safe and get these symptoms checked by a healthcare provider to ensure there isn't a more serious problem at play. Sign 5. Mouth sores that won't heal. Oral cancer can develop in any part of the mouth, including the lips, tongue, and throat. If you use tobacco or drink heavily, your risk is significantly higher. The Oral Cancer Foundation states that around 90% of oral cancer cases are linked to tobacco use, including smoking and chewing tobacco. Additionally, heavy alcohol consumption significantly increases the risk. Interestingly, there is a growing body of research indicating that human papillomavirus, HPV infection, is also a significant risk factor for oral cancers. Imagine that sore in your mouth that won't go away being more than just a harmless ulcer. Early detection is key, so it's essential to get any persistent mouth sores evaluated by a healthcare provider to rule out serious conditions and start appropriate treatment if needed. Sign 6. Blood in the urine or stool. Noticing blood where it shouldn't be? Blood in your urine or stool is alarming and should never be ignored. Blood in the stool can appear black, tarry, or red, while blood in the urine can be pink, red, or dark brown. These symptoms could be indicative of serious conditions, including cancer. Blood in the stool may signal digestive system cancers such as colon or rectal cancer, while blood in the urine can be a sign of prostate or bladder cancer. The American Gastroenterological Association points out that colorectal cancer often starts as benign polyps, which can bleed and turn into cancer if not removed. Similarly, blood in the urine is a common sign of bladder cancer, which affects around 75,000 people annually in the U.S. Did you know that certain foods, like beets and berries, can sometimes cause your urine or stool to change color, mimicking blood? However, it's always important to confirm with a healthcare provider. Have you seen blood where it shouldn't be and convinced yourself it's nothing serious? It's vital to seek medical attention immediately to determine the cause of the bleeding and initiate any necessary treatment. Sign 7. A cough or hoarseness that won't go away. Are you dealing with a persistent cough or hoarse voice that won't go away? If it's been more than 2 weeks, it's time to see a doctor. A persistent cough or hoarseness could be a sign of lung cancer or other serious conditions. Coughing up blood or bloody discharge is particularly concerning and needs immediate medical attention. Hoarseness, or a raspy, strained voice that doesn't go away, can also be a warning sign of thyroid or throat cancers. According to the American Lung Association, persistent cough is one of the most common symptoms of lung cancer, which is the leading cause of cancer death worldwide. Similarly, voice changes can indicate laryngeal cancer, especially in smokers. Interestingly, chronic coughs can sometimes be linked to acid reflux or other non-cancerous conditions, but it's crucial not to overlook them. Is your persistent cough or hoarse voice a sign you're overlooking, assuming it's just a minor issue? Don't dismiss these symptoms, as early detection and treatment can significantly improve the prognosis for these cancers. Sign 8. Excessive bruising. Have you noticed bruises appearing out of nowhere? Excessive bruising in unusual places can be a sign of certain blood cancers. If you see bruises appearing without any clear cause, it's important to see a doctor. These types of bruises can indicate issues with your blood cells, such as leukemia. Leukemia affects your body's ability to produce healthy blood cells, leading to symptoms like excessive bruising. In addition to bruising, you might notice other symptoms like frequent nosebleeds or bleeding gums. The Leukemia and Lymphoma Society notes that leukemia can present with bruises that seem to appear out of nowhere and don't heal quickly. Interestingly, some people with leukemia also experience night sweats and unintentional weight loss. Are those unexplained bruises a warning sign of something more serious that you've been ignoring? It's crucial to get any unexplained bruising evaluated by a healthcare provider to ensure there isn't a serious underlying condition. Cancer can present itself in many ways, and recognizing the early signs is crucial for early detection and treatment. We've discussed the importance of paying attention to persistent fatigue, unrelenting headaches, changes in urinary or bowel habits, unexplained pain, mouth sores that won't heal, blood in the urine or stool, persistent cough or hoarseness, and excessive bruising. By staying vigilant and seeking medical advice for these symptoms, you can catch potential issues early and improve your chances of effective treatment. Have you or someone you know experienced these signs? Share your story in the comments. Thank you for watching this video. Please give it a thumbs up and share it with others who might benefit from this knowledge. Don't forget to subscribe to our channel for more informative health content. See you in the next one.